everybody. Welcome, welcome, welcome. This is part of our good news segment. We've been bringing you these absolutely incredible sets of information about how you can take action on your own behalf in life and how you can become better informed. Today, Dr. Shannon Kasperbauer is joining me here today, infectious disease physician at the National Jewish Health and assistant professor in the division of this is a tongue twister, mycobacteriology and respiratory infections at the University of Colorado School of Medicine in Denver. But this show is super important. As many of you know, COPD is a phrase we hear everywhere. It's on television, but guess what? We don't really know that much about it. Today, Dr. Kasperbauer is going to take us on a journey about what COPD is, what we should know about it, and why is it that not just those that have it should be aware, but those around our loved ones. Dr. Shannon, welcome to the show. It's great to have you here.
Thanks so much for having me.
It's one of these things, COPD, when you hear it, it's on television, it's on commercials, it runs throughout the day, and many people don't really put a finger on it to say, yeah, that's something I should know about, except when those of us that we know, our loved ones or our friends, have it and are affected by it. What is your vision? What is your passion for bringing this out into the world and having this conversation with us?
So I'll just start by saying COPD, just as a definition, it stands for a chronic obstructive pulmonary disease. And a lot of people associate that with smoking use and emphysema. But there are other forms of obstructive lung diseases, including asthma and chronic bronchitis. And what I'd really like to alert your viewers to today is a chronic infection that happens disproportionately in those patients with COPD. And that infection is called NTM. And very simply, NTM stands for non-tuberculous mycobacteria. And this is an organism that's found readily in the environment, so we're all exposed to it all the time. It's in the water and it's in the soil. And when it's aerosolized, we inhale it. Most of us just get rid of it on our own because we have normal airways and we're able to clear the bacteria easily. But people with COPD are not, and they have much higher rates. In fact, it's been estimated that they have a 15-fold higher risk of developing chronic NTM lung disease, which presents as a progressive chronic pneumonia.
I would imagine that it's very difficult for people to even get a good diagnosis as to what's going on. So often we're hearing now for so many people, oh, you must be allergic to something. Oh, you just got the bug. Oh, and don't you find that this is confusing for people to really figure out what's going on? And yet, this is a pretty devastating disease. And I think it's important for people to know, am I at risk? How do I know that it's not just like an allergy of something in the room?
Right. So that's a great question. And I'll start by saying there are certain people who are at greater risk, including those with chronic obstructive lung disease, to get this chronic infection. And those would also be people that have compromised immune systems. So if you have an autoimmune condition and you're on a rheumatologic agent, for example, people that are older, so over the age of 65 is certainly a risk factor for NTM lung disease. Women are disproportionately affected compared to men. And important for your viewers, we actually see higher rates of NTM in people that live in coastal regions. So 7 out of 10 cases of this chronic infection occur in people that are in the coastal parts of the United States. And just like you said, a lot of people, we don't understand because the symptoms are nonspecific. They may just have a chronic cough. They might have some shortness of breath or fatigue, which is very nonspecific. Some people will have weight loss or poor appetite. And certainly if you had symptoms of fevers, night sweats, or chills, that would be something to alert that there could be a chronic infection going on. But we also recognize that there's a group of patients that just have recurrent episodes of bronchitis or pneumonia that are partially responsive to antibiotics. And because these are all nonspecific symptoms, our patients with NTM lung disease have frequent delays in diagnosis. So they can go months and years without getting diagnosed properly.
Yeah, and you said something really important because I think that for many people, you get an antibiotic, you take the antibiotic, maybe you start to get a little better, but maybe you start coughing. You're trying to get down a bite of food and you cough. After a while, when you have a condition like this, you kind of think it's normal, but not really, right?
Exactly. And it's oftentimes the people around that person who's coughing who say, oh yeah, you're coughing all the time. And you get used to it. Absolutely. But it's important to get tested. And the reason is that if this diagnosis goes undiagnosed, you can develop irreversible changes to the lungs. And we want to catch people early in their disease process to prevent that permanent damage. Right. No one wants to hear that. Right. Well, I'll say that the people that are really familiar with the diagnosis and treatment of this lung infection are either infectious disease physicians or pulmonologists. And so they'll do a detailed history and physical, but they'll also take two more important steps. And the first is to culture your sputum. And so they will be looking for the mycobacterial germ in your sputum cultures. And the second is to order a CAT scan of the chest. So that might seem like a lot, but it really is important to get that CAT scan so that we can understand the definition of the disease and how significant is the disease in someone's lungs.
Who are the most aware? Now, this may sound like a trick question, but it's not. You said something interesting. Sometimes when we have something chronic, and I say chronic because you have it, you get a condition, you don't feel the best you could feel, but you kind of get used to it, and then it becomes the norm. Family members that see this, friends that see this, you know what I'm saying? They're the ones that say, maybe you should blank, blank, blank. What's fill in the blank for me? Maybe you should what?
Maybe you should talk to your doctor about your symptoms. And I think, really understanding this takes some research, and finding out what your resources are. So there are two important websites that I would alert your viewers to. And one is called aboutntm.com. And they can go on and read more about the symptoms, about how to start that discussion with their provider to move things forward. The second website is ntminfo.org. And this website is an excellent tool for connecting people with other patients who have NTM lung disease, whether that be through online forums or local support groups in their area.
I find this, I find speaking to you fairly interesting for a lot of reasons. One, I was looking at your background, and I was looking at, the work that you do, the work in infectious disease, your affiliation with ATS and Infectious Disease Society of America. I'm curious about your passion, and what gets you involved in getting out there and spreading the word on this?
Well, first of all, I would say that I was inspired by my mentors, and it's always nice to work with people who love what they do. So that got me into this field of medicine. But once you get into it and you really enjoy what you're doing and you get to know your patients and you understand that this is an orphan disease that people aren't paying enough attention to, And so that's what really drives us all in this small community of NTM doctors to try and move things forward and encourage research and development in this field.
I think that for the most part, the people that are least aware of that this may be going on and that they may have lung disease are the people that actually may have it. Can you go through a list of symptoms? I know we mentioned a couple, but can you give us a list?
Yeah, so I'll reiterate those because those are really important. And again, they're chronic symptoms. So a chronic cough, and it doesn't have to be productive of sputum. It can just be a dry cough. Again, fatigue, shortness of breath, fevers, chills, or night sweats, and weight loss. And then the group of folks that just have recurrent episodes of bronchitis or pneumonia that's not responding well to antibiotics. Those would all be clues to talk to their physicians about getting the right tests done, doing those sputum cultures, and getting a CAT scan of the chest to really understand, could they have underlying NTM lung disease?
Yeah, I think that, this is where you can get information. The other thing, too, is how do people find out? Now, like all of us are so connected to the internet, and especially women. I mean, the latest statistics on moms over 35 and the degree by which they are on their smartphones on the internet is just staggering. I mean, it's an unsuspected thing. But there's got to be places for people to find out about this.
Oh, absolutely. So those two websites, aboutntm.com, again, that is a great website to understand the lung disease and to understand the right questions to ask your providers to allow you to move forward with the diagnosis. And then secondly, that website, ntminfo.org, which connects people with other patients all around the country. And there's support groups all over the United States that meet, in local communities and then online communities to support one another.
Okay, so let's talk about what happens now that I find out this is something I have. What can be done? I think that's what our listeners want to get to is like, okay, now I find out. Now what?
Great question. So in general, the goal of treatment is to use a cocktail of antibiotics that are going to be effective against that germ that they cultured from their sputum and allow their sputum to turn what we call negative or not be able to find the bacteria in their sputum any longer. Unfortunately, that takes several months of treatment to be able to achieve that goal. And each patient is a little different, so I can't go into specifics about the treatment regimen because the patients are different, the organisms are different. But there are excellent guidelines that are the 2007 publication from the American Thoracic Society and the Infectious Disease Society of America that is the current standard of management for patients with NTM lung disease.
Well, this again is the doctor. Can I ask you a question? Which
Sure.
doctor you go to? We're getting a question coming in here. Which doctor do you go to? Do I go to my general doctor? Because 9 times out of 10, that may not be the end of the road. Where should they look?
Correct. So oftentimes what we find is that the infectious disease specialist or a pulmonologist are going to be the most familiar with this diagnosis and familiar with the treatment regimens.
Okay, so all of the above then kind of leads to, in the end, can I get better?
Absolutely. You absolutely can get better. And there are many tools that we use to help patients get better. But the whole goal of treating someone is to cure them of the infection. And I'll just say that the sooner we diagnose patients, the more likely that is to occur. So if we struggle with delays in diagnosis and people develop irreversible permanent damage to their lungs, that will make it harder to cure them of that disease.
Mm-hmm. One last question. How long does the process take?
The process of treatment or the diagnosis?
Treatment.
So again, that varies from patient to patient or organism, but the whole goal and what we describe as the mantra of treatment is to Continue to check those sputum cultures, and once we have negative sputum cultures for 12 months, then we say that that patient has been cured and they can stop treatment.
Wow. This is so informative. Thank you so much for today, Dr. Shannon. One last question. Again, please tell us about the website, but what's your personal message? What do you want to leave us with today?
I would say know if you're at risk. Don't ignore your symptoms. There are simple tools to get diagnosed with a sputum culture and a CAT scan. And know that there are two excellent resources online, the aboutntm.com and ntminfo.org, to answer any further questions they might have about this lung condition.
Wow. Thank you so much. Thank you for today. Everyone, again, please make sure you go to the website. Please make sure that you know today in the show you heard some action that you can easily take. And remember, this is about living long, living life, and living it full out. Thanks for joining us here today.
Thank you so much.
You bet.